The EULAR Quality of Care Committee is responsible for maintaining, updating, but also designing the EULAR recommendations. And the EULAR recommendations is, so to say, the guidelines for rheumatologists, health professionals, also patients. And in those guidelines, those recommendations that we develop for the main diseases, but for many other topics that are relevant in the realm of rheumatology, what doctors should do, what patients should do, what is the best possible treatment, how should you diagnose a patient. And we typically do that in our EULAR recommendations projects, in which we have task forces developing bullet lists with what is crucially important for the management of the diseases for patients with RMD. What I am as a chair of quality of care really proud of is our EULAR recommendations for the management of rheumatoid arthritis. Obviously, rheumatoid arthritis is core business for the rheumatologist. And these recommendations now exist since 2010 and have in the meantime had quite a couple of updates. And in those updates, actually, we have been able to very well propose the current standard of care for patients with rheumatoid arthritis. And that it is so important is actually shown by the fact that many organizations, many professional organizations all over the world use the EULAR recommendations as a template, and especially for rheumatoid arthritis that is the case. Well, the vision of the EULAR's Quality of Care Committee is that it in itself, in its basics, in its fundamentals, is a pretty conservative committee. And with conservative, I don't mean old-fashioned, but with conservative, I mean that we should keep what is good and change only very slowly, namely by that what should be updated. And if you read through our recommendations, you don't see diametrical changes over time, but you see over time in the subsequent updates of the existing recommendations slight adaptations to the modern situation. The new updates are reflecting the increased insight and the increased science that has been done over the last couple of years. So that is something that the EULAR Quality of Care Committee is the guardian of, and we should make sure that in future that will remain. EULAR gives the assignment to the Committee of Quality of Care to maintain, to sustain its set of recommendations, and EULAR is the party who provides not only the money but also the knowledge and the insight, because all the members, so to say, of the EULAR are scientific members, are scientists, clinical scientists from all over the world, but particularly from our member countries within Europe. And all together, this EULAR environment, this EULAR world, so to say, comes together in task forces, in well-represented task forces, so that most of the different areas, but also most of the different arenas in EULAR are reflected, represented in the task forces that we run, and those task forces are critical for good quality EULAR recommendations. The Congress event, like we are here now, is extremely important for the work of the Quality of Care Committee. Actually, right this afternoon, on Wednesday afternoon, we have our main session with new updates of EULAR recommendations. Those sessions are always highly visited and highly appreciated. And actually, the EULAR Congress is the podium on which the Quality of Care Committee can tell about its results and about its novelties, about their updates and recommendations. So Congress is truly important for EULAR Quality of Care. So you will not be surprised that my highlight as Chair of Quality of Care will be that EULAR session of this afternoon that I'm supposed to chair, and in which we present 3 brand new updates of existing recommendations, namely those of ANCA-associated vasculitis, that of axial spondyloarthritis, and that of rheumatoid arthritis. And if you think about the number of patients that all together suffer from these diseases, you can easily imagine how important this session at EULAR 2022 will be.